I'm John Lloyd, the president of Meridian Health System, and I've actually been with the health system since it was created in 1997. When I think about what sets Meridian apart from other health systems, I really think of one thing: great people. And those people include trustees, executives, team members, our donors, and physicians.
I'm Michael Espinoso.
My name is Dr. Adnan Danish.
Kim Alfiero.
There are many colleagues in many specialties here that have the same level of commitment, dedication, and focus, second to none.
Meridian has created a culture of excellence. Some would say it's our brand promise.
When new people come in, they sense that there's a nursing culture, a medical culture within the hospital that's very positive, very supportive.
All of our team members are aligned to provide an exceptional experience for both our patients and our guests. And that's something they do with passion, compassion, and in a caring way for every patient they come in contact with.
We want everyone to succeed. We want to cure everybody. We want to make everyone better. And everyone here works together towards that goal.
All are committed to the same level of excellence in providing the best care to each and every one of their patients.
Our physicians continue to develop new clinical programs and new technologies throughout Meridian. When I think of some of those technologies, I think of the wonderful trauma center that exists at Jersey Shore University Medical Center that every day is saving lives. Or I think about the CyberKnife at Riverview, a very innovative way to treat certain forms of cancer. Every day we have wonderful patient stories at Meridian.
As I was paddling, one of the lips of the waves pitched me backwards, bounced me off the ocean floor. I couldn't move my right arm. My wife transported me to the emergency room, and I was diagnosed with a broken neck.
Our team was able to successfully operate on Harry and regain him back to function.
I'm so grateful, and I can't thank them enough, because I know that I could have been completely paralyzed.
Prostate cancer is one of the most common cancers a man can have in his life.
It turned out that my PSA was 13. Fortunately, a link led me to Riverview. The experience that I had here was terrific.
He had an excellent response to radiosurgery.
After the treatment, my PSA was 0.3.
He was able to return to his lifestyle, and most importantly, his cancer is cured.
I'm probably the luckiest guy in the world.
Lined up on the runway, everything looked normal, lifted off, and about 300 feet, something broke on the engine, a lot of vibration, a lot of smoke. Ended up landing right next to the runway, and they put me on a gurney, it got me in a helicopter, and when I showed up, apparently I was not breathing, no pulse.
He was in the operating room. He had ruptured his mesenteric artery. He had multiple fractures. After a long, long night, I got to his bedside, and the doctor was saying, "John, move your feet." And he did move his feet, and I just collapsed because I knew his brain was intact, and so was his spine. So I knew he was going to be okay. I'm very grateful that that's where we ended up.
I got to the right place at the right time. The words just don't exist that say, "Hey, you brought me back to life. I am here because they were there."
Jersey Shore gave me back my husband and gave my kids back their father, and I can't thank them enough for that.
In fact, our daughter is now there as an internship. We'd want her to be there. That's, you know, she's learning from the best with the best.
A car did not see my son and hit him head on. Billy was unconscious. I kept saying, "Billy, wake up. Fight for your life, wake up." We arrived, and they quickly moved him to the trauma center. I didn't know what was going to happen, but when I left that room, I knew that these doctors were going to fight very hard to save my son. And I felt good that he was going to get through this terrible thing that has happened to him. I can't thank them enough. I can't. My son today is in his 3rd year of medical school. He's thinking about being an orthopedic surgeon.
We got pregnant in 2009. We were so excited about it. We went in, had the normal sonogram. We get in the office and he says to us, "I'll never forget this. We have something to talk about." I said to him, "What do you mean?" He goes, "She's very little. You're going to the hospital." And she was born at 9:05 that night.
She weighed 1 pound and 12.5 ounces. They pushed Mary up to the NICU and I followed them. I mean, our lives were changed instantly. As soon as we got to the NICU, you could tell that They knew what they were doing.
I actually remember the day that they came in. They just had tremendous faith.
The nurses and doctors started the name Miracle Mary. And she's our little miracle.
From the beginning, that child was a fighter.
We look at her and we're just so thankful.
Everybody has different reasons for giving back. Someone provided a good service for them. Someone changed their life.
The people here were so wonderful.
The professional care and the love is the reason she is what she is, a healthy little baby. We became donors because of what we witnessed.
I mean, how could we not? They saved our daughter's life.
It was our way of saying thank you.
It's those donations that allows us to provide the best medical care for our community.
All health systems and hospitals today have a lot of challenges in this very tough environment. For that reason, fundraising has become an important success factor for all hospitals and health systems. So we view our donors as part of the Meridian family. We work with them, they support us, and we're very grateful for everything they do for our patients.
We feel fortunate enough to have enough to give to others.
Philanthropy is a way for me and my family to give back to the community, to a cause that is very close to our heart.
By giving, it not only rewards us, but it's a benefit to society as a whole.
We feel very blessed that we can help other people get through their troubles.
It always makes me feel good when I can help someone with a problem, especially in health, because I'm 75 now. And somebody's gonna help me somewhere along the line also.
We feel that's most important, to be able to have an incredible hospital network right at our back doorstep.
Prior to Meridian, I took my parents many times to New York City to have what we thought was the best health care we could possibly find. But since Meridian has taken over, the quality of care has been excellent. We don't need to travel to New York
to get the excellent health care that we want.
You can never understand how valuable that is until you need it.
The Meridian Gala has always been a premier event, probably one of the most exciting and best events in the state.
When we got the call to chair the Meridian Gala from John Lloyd, I looked at Jack and I said, there's no answer but yes, we have to do this for our community. We're all here for the same cause, and that's to raise money for our local hospital network, which is one of the most important things that any of us can do.
We should be proud of the fact that we're raising a lot of money, because it's going to help us deliver better patient care. And it's all about the volunteer leaders. And when you look at the chairs and co-chairs of this year's event, it's an all-star lineup.
We have a great group working on this year's event.
Jack and I are so honored to be chairing the Meridian Gala 2011. Anita and Joe Roselli are co-chairs with us, along with Tisha and Anthony Bonanno. We have 4 incredible chairs of the Ad Journal: Dal Wegener, Maureen Lloyd, Kathy Weiland, and Gina Patillo. Connie Bonanno is chairing the entertainment and decorating. The auction chairs are Molly Giamanco and Francine Acquaviva. The raffle committee is chaired by Danielle Diodano, Chris Mariani, and Jamie Stavola. And finally, the underwriting committee is chaired by John Lloyd himself. A big thanks to all of our chairs for making tonight the most incredible Meridian Gala ever.
Thank you for being here. Thank you for your gifts. Thank you for your thoughts and generosity.
If you could donate and help save a life, you're giving them the gift of love.
To donate to the hospital is probably one of the best things you could ever do.
Your money would never go to waste.
Give what you can, because you're transforming people's lives.